Good morning, Dr. Wendy. Today, we have been given a scenario to talk about. So the scenario given is, you are on morning ward rounds in a general ward. You notice that one of your colleagues, a junior doctor, is behaving unusually, with inappropriate behavior, impaired coordination, and with the smell of alcohol from his breath. Your colleague is actively reviewing patients and writing orders in the patient's files. You feel deeply concerned, but you are unsure how to proceed. So in this scenario, the junior doctor is likely under alcohol influence. And then it is a busy morning ward round and definitely a very stressful condition to be in. So my response to be focused on code of professional conduct, because at the end of the day, patient safety is the absolute non-negotiable priority. So there are two core ethical principles to be applied in this scenario. First and foremost is non-maleficence, which means do no harm, either to the patient or to the colleagues. This is to avoid any actions that risk injury or negative consequences to others. Second is beneficence. This is to act in the best interest to others, especially patients and colleagues in this scenario, to promote well-being and positive outcomes. So I have to step in immediately in this scenario because a wrong medication dosage and missed clinical signs could be fatal to the patients. So firstly, I will pull my junior colleague aside and talk with him in an enclosed quiet room or either in the pantry with nobody around. I will not confront him in front of the patients or other colleagues like staff nurses to protect their dignity. So I will tell him that his condition currently is not fit for his clinical duty today. I will need him to stop seeing patients right now, and I will help him to find a medical officer to replace him to cover him for his clinical duty today, so that the care for the patients will not be disrupted. Secondly, I will take all the patient's case notes that he has reviewed this morning and counter check to make sure there's no mismanagement. I will ensure that the orders or plans given by him is appropriate, and I will cancel out all unnecessary or inappropriate plans to ensure there's no harm devoted to the patients that he saw this morning. Next, I will also escalate this issue to my superiors, as it is a major clinical issue, and I don't think that it is suitable for me to handle alone at my level. And of course, I will explore more for the underlying reasons for my junior colleague action. I will try to talk to him personally and try to understand if he is experiencing any significant life stressor or any adverse events or condition that lead him to work under alcohol influences. If indicated, I will refer him for a proper professional counseling. And lastly, it is crucial to have a frank discussion with him and to emphasize with him that doing duty under alcohol influence is not appropriate. This behavior is not only severely compromising the patient's safety, but also jeopardizing his career progression in the future. That's all from me. Thank you.